We're back. This is Health This Week. I'm Don Baillargeon. Thanks for staying with us. More than 4 million children between the ages of 6 and 17 play tackle, touch, or flag football, and certainly more than a few of them harbor aspirations of someday wearing an NFL uniform. But as the size of professional football players has increased over the past 20 years, so is concern that this might put them at greater risk of heart disease, along with other athletes striving for the same size. Haley Weldon explains in this week's Journal of the American Medical Association report.
Measuring in at 6'3", 310 pounds, for Baltimore Ravens defensive end Justin Bannon, bigger is better.
When you're playing inside, a lot of times you're taking on, 2 offensive linemen at a time, and these guys are huge.
All football players are getting bigger across all positions, but the most dramatic changes over the last 20 years or so have related to the linemen. Being a larger size in the blocking scheme as well as on the defensive line has become increasingly important.
But as players increase their size, are they also increasing their health risks? As part of the NFL Committee on Cardiovascular Health, Dr. Andrew Tucker of Union Memorial Hospital in Baltimore and the Ravens head physician led research that assessed cardiovascular disease risk factors in over 500 active NFL players.
The players are extremely large, and yet it's a population that's extremely active. So there has been ongoing debate about the effect of size versus the effect of activity on cardiovascular risk.
Featured this week in JAMA, Journal of the American Medical Association, the study found that compared to men of similar age in the general U.S. population, NFL players had an increased prevalence of high blood pressure, but less reported smoking, lower prevalence of impaired fasting glucose, a pre-diabetic condition, and similar blood cholesterol levels, although the players were substantially larger in size.
Activity, vigorous physical activity, appears to significantly decrease or lessen the effect of size on cardiovascular risk.
Important information for current players and other athletes to remember down the road.
I don't think you're going to train the exact same that you are now when you're retired. So I think you really got to make some lifestyle changes so you can have a good quality of life down the road.
Haley Weldon, the JAMA Report.